Hi, my name's Ashley. I'm going to be your nurse today, and I'm going to perform a full head-to-toe health assessment on you. Okay? So to start off, I have some equipment with me. I have my stethoscope, I have a pen light, I have some gloves, and sanitizer, and an alcohol swab. All of those are help to prevent infection control. I'm going to perform hand hygiene, as well as clean my stethoscope to help with infection control. Okay, so do you use any assistive devices? No, patient does not use any assistive devices. If you have any pain or discomfort throughout the entire process, please let me know. Can you please state your name for me?
Nicole Megan.
Okay, and can you state your current location?
The doctor's office.
Okay, and today's date?
It's Saturday, November 21st.
Okay. Patient is oriented ×3. Her level of consciousness is appropriate. Her speech was clear and not slurred. Can you please smile for me and frown? And can you puff out your cheeks and then raise your eyebrows? And then I'm going to put my hands on your shoulder, and can you please raise them against my resistance? Okay, so patient's cranial, facial, and spinal nerves are all intact. The next thing I'm going to do is have you close your eyes. I'm going to touch you in a few places throughout your body, and please just tell me out loud where I'm touching you.
Left foot, right leg, left arm, left cheek.
Okay. Patient sensations are intact, and she was able to tell me where I was touching her on her body with her eyes closed. Now can you please raise your hands and touch each finger to your thumb individually and back again. Okay, patient's fine motor skills are intact. Now can you please stand for me and walk to the end of the room so I can assess your gait, and then turn and walk back. Okay, patient's gait is appropriate. There was no swaying, stumbling, or limping noted. So her walking looks great. Can you please stand on one foot and then put it back down and stand on the other? Okay, and then can you put both of your feet together, raise your hands and close your eyes? Okay, you can put them back down and open your eyes. There was no swaying or falling noted with any of her balance tests, so her balance and coordination is appropriate. Now I'm going to have you turn around, and I'm going to assess your spine, so if you could please dive forward. Okay. There was no palpable masses along her spine. Was there any pain upon any of that? Nope. Okay, so her spine was aligned appropriately with her body at midline, and there was no curvature of the spine, so there's no signs of kyphosis, lordosis, or scoliosis. Her skin looks good on her arms and her face. It is pink and dry, and it is warm to the touch as well. Now I'm going to assess her range of motion. So I'm going to place my arm on your shoulder. If you could move your arm in a big circular motion. Okay. Was there any pain upon that? Nope. And there was no crepitus heard. Can you lift your arm up, flex your elbow, and put it back down? Any pain? Nope. No crepitus heard. And can you rotate your wrist? Circle. Any pain? Nope. No crepitus heard. Now I'm going to do the same with your other arm. Can you please move your arm in a circular motion? Any pain? Nope. No crepitus heard. Good. Any crepitus? Or any pain, rather? No. And I heard no crepitus. And can you rotate your wrist? Any pain? Nope. And no crepitus. So her range of motion in her arms and wrists and elbows are good. Now can you please, I'm going to test the range of motion in your lower extremity. So can you move your leg forward, back to center, and then behind you? I know we're a little crowded. You can step forward, and then up to the side. Any pain? Nope. No crepitus either. And the same with your other leg. Okay. Oops, sorry. And bend your leg. And did I have you bend your leg? I'm gonna have you bend your leg over here. No crepitus. Any pain on any of those?
Nope.
Nope. Okay, so the range of motion is good in her lower extremities. Now, can you sit back down for me? Okay. I am going to now assess her head and neck. The first thing I'm going to do is assess her range of motion in her head and neck. So can you please bend your head forward to your chest and then back as far as you can, and then to center and to each side, back to center. And I heard no crepitus. Any pain? Nope. Okay, so the range of motion in the neck is good. I'm going to assess her head and neck now. Her head is an appropriate size and shape for her body. Her head and neck and trachea are aligned midline well with her body as well. Her skin is an appropriate color. It is pink and dry. I'm going to perform hand hygiene. And put on a pair of gloves. Okay, so the first thing I'm going to do is assess your scalp. So I'm going to run my fingers through your hair. Okay, I do not notice anything palpable along her scalp. There are no critters, as well as the color and texture of her hair is appropriate. Her hair is evenly distributed throughout her head. The hair on her eyebrows and eyelashes are also well distributed and in appropriate fullness for her face. I am also going to assess her sinuses now. So I'm going to place my fingers along your sinus, along your face and neck. Please tell me if you have any pain or pressure. Any pain or pressure so far?
No.
And I'm now assessing her lymph nodes. Okay, any pain or pressure? Nope. Nope. So lymph and sinus are good. Can you please swallow for me? Okay, her swallowing reflex is intact. I was not able to palpate her thyroid, so there's docoider present as well. Now I'm going to assess her for TMJ, I'm going to assess your jaw. So if you could open and close your jaw. Any pain? Nope, no crepitus heard either, so there's no sign of TMJ present. Now I'm going to assess her ears. So I'm going to feel along your ears. I didn't feel any nodules. There seems to be no abrasions or erosion on her ears. The skin is pink. It's warm and dry to the touch on both ears. I'm now going to assess for drainage in them. No drainage noted in either ear. Do you have any problems hearing that you know of? Any
Nope.
tinnitus or ringing in the ear?
Nope.
Pain? Okay. I'm now going to perform the whisper test. So I'm going to whisper 2 words, and if you can please repeat to me what they are.
Hello. Goodbye.
Okay, patient was able to pass the whisper test. I'm now going to assess her eyes. Her eyes are an appropriate shape and location for her head. Her irises are an appropriate brown, and her pupils are about 4 millimeters in size. And her sclera is white. And I'm going to assess her conjunctiva. There's no sign of drainage in her conjunctiva, are pink and healthy looking. I'm now going to assess pupillary reaction to light in her eyes. So I'm going to put my hand on your nose and I'm going to shine a light in each eye. If you could just continue looking straight ahead. Okay, her pupils constricted bilaterally and consensually, so her pupillary reaction to light is intact. I am now going to perform an accommodation test. So I'm going to hold the pen out in front of you, and if you can look at it and just follow it, I'm going to bring it close to your face. Okay. Her eyes accommodated appropriately. They were able to follow the pen in and out consensually towards her nose. I'm also now going to perform the cardinal fields of vision test. I'm going to hold the pen out in front of you again, and if you could just follow it with your eyes and not your head, I'm going to move it around. Okay, patient was able to pass the 6 cardinal fields of vision test, and now I'm going to test your peripheral vision. So I'm going to stick my hands beside your head, I'm going to wiggle my fingers and bring them forward. When you see them, just let me know.
I see them.
Okay, her peripheral vision is intact, so her eyes all around look great. I'm now going to assess her nose. Her nose is an appropriate size and shape for her head. Her skin looks good on her nose and healthy, pink, warm, dry. There seems to be no abrasions or lesions on her nose or any of her face. Could you please put your finger on one side of your nostril, completely close it, and sniff in and out? And with the other side? Did you have any trouble with that?
No.
No? Patient's breathing seems intact. Do you have any problems smelling that you know of?
No.
Do you also have any problems seeing that you know of?
No.
Okay, good. I'm now going to assess your nose by looking into it and look for drainage. I don't see any drainage present. There's no noted deviated septum as well. And now I'm going to assess her mouth. Her mouth is an appropriate shape and location for her face. Her lips are pink and moist. They don't look cracked or dry at all. They look well hydrated. Can you please open your mouth and say ah? Okay. Patient's mucosal membranes are pink. There appears to be no signs of cyanosis. Her uvula is present in an appropriate side, as well as her tonsils are present and appropriate in size. Her teeth look healthy. There seems to be no plaque buildup. And her tongue was well hydrated. There was no cracks or fissures. It's a healthy pink. And if you can please stick your tongue out for me. Okay. Did not deviate to either side. Overall, her mouth looks great. There was no odor present on her breath. Okay, so I'm actually going to assess your pericardium now. I'm going to palpate it. Okay, there was no palpable flutters or abnormalities with the heart. I'm now going to listen to your heart or auscultate it. Okay, the rate and rhythm of her heart is normal. I didn't hear any abnormal heart sounds. S1 and S2 were heard, and her mitral and tricuspid valves are working appropriately. I'm now going to assess her carotid pulse. Okay, the rate and rhythm was normal, and now I'm going to oscillate her carotid pulse as well. Okay, there was no bruit or whooshing heard. The rate and rhythm again seemed normal. No abnormalities heard or felt in her carotid pulse. And actually, I'm also going to assess her hands and her radial pulse now as well. I'm going to remove my gloves. And perform hand hygiene. Okay, can you please hold out your hands for me? Okay, so the skin of her hands is dry, warm to the touch, and pink. I'm going to assess her capillary refill. And it is under 3 seconds, which is great. There is no clubbing present in the fingernails. Her skin turgor is good. There's no tenting noted, which means she's adequately hydrated. Now assessing her radial pulses. Pulses are equal bilaterally and 2+, as well as her carotid pulse was as well. No abnormal rates of rhythm noticed in the radial artery either. That all looks good. I'm now going to assess her breathing. Her breathing does not look labored so far. Do you have any trouble breathing that you're aware of? Okay, can you please stand up for me so I can auscultate your lungs? Actually, first I'm going to have you take in a deep breath and exhale. Okay, looks good. My fingers moved as she inhaled and exhaled. There doesn't seem to be any labored breathing with that as well. And I'm going to auscultate your lungs. If you could take a deep breath. And another. One more. And another. If you could raise your left arm, please. Another deep breath. And another. Okay, can you please turn around? And one more. Okay, lungs sound good. I did not hear any wheezing, crackles, or rhonchi present. No labored breathing once again. Lungs look good. Okay, can you please sit back down for me? And if actually you could lay down and put your legs up, what I'm going to do now is assess your abdominal area. I'm going to, is it okay if I lift your shirt? Yep. Okay. So looking at her abdominal region, there is no abnormalities present, no lesions or masses noted upon appearance. Her skin looks pink, warm, and it's dry to the touch. And I'm going to now auscultate both her bowel sounds in all 4 quadrants as well as the vascular portion of the abdominal cavity. Okay, abdominal sounds were heard, or bowel sounds rather, were heard in all 4 quadrants. And her vascular sounds were heard as well. There does not seem to be any presence of an aortic aneurysm. I'm now going to palpate your stomach. If you could tell me if there's any pain or pressure, or well, there will be pressure, but tell me if there's any pain. Any pain? No. Again, any pain? No. Okay, everything feels great internally. No masses or any abnormalities felt upon palpation. While you're laying here, I'm going to assess the range of motion in your ankles. If you could please rotate your right ankle in a circle. Any pain? No. Nope, no crepitus either. And your left? Any pain? No. Nope, no crepitus noted either. I am now going to assess her skin turgor, which looks good on both feet. No tenting, which means she's probably well hydrated. No clubbing noted in her nails. And capillary refill is within 3 seconds. I'm going to now assess her posterior tibial pulses and her dorsal pedis. Okay, all 4 pulses were felt. They were equal and 2+ bilaterally. No abnormal rates or rhythms noted. And if you could please sit back up for me once again. And I'm going to assess the strength in your lower extremity. So if you could push up and push back down with your leg, and with this one, and back down. Okay, the strength in lower extremities were 5+ each, which is great, or 5 out of 5 rather. And now I'm going to assess the strength in your upper extremities as well. If you could hold your arms out for me. Okay, can you push up against my arms? Okay, and back down. And can you push out? And can you push my arms in? Okay, strength in the upper extremities were 5 out of 5 as well. Can you now recall the 3 words I gave to you?
Moon, fan, bag.
Okay, perfect. So your short-term memory is intact as well. Everything looks great. Thank you.
Thanks.